you. So I won't attempt to channel Paolo in answering the questions on hepatitis B, and we'll move straight to Frank Sachs, who's a professor of nutrition and medicine at Harvard. Also, first publication with Dimitrios, 1995, 20 years ago, Mediterranean Diet Pyramid, a cultural model for healthy eating. Frank.
Thank you, Antonia and Michelle, for inviting me. I'm very happy to have been invited to speak here, to really discuss the Mediterranean diet and the contributions Dimitri made to it and the work we did together. What I really got to know Dimitrios through the work that we did in the Mediterranean diet and health, particularly in cardiovascular. In the early 90s, all the way up through the mid-2000s, we in nutrition science had a lot of trouble with, you might say, nutrition orthodoxy. And I see Walter nodding his head because we fought the battles. So nutrition orthodoxy here was very much focused on low fat, and the idea was that we should advocate low fat diets in order to get rid of the saturated fat in the diet. So that was a peculiar approach, because what happened is that the low fat foods, or many low fat foods, were developed and marketed. And it was essentially a junk food diet. A junk food low-fat diet was being promoted by our colleagues, our nutrition science colleagues. So that was a tremendous fallacy. And really, those of us who have been doing nutrition science, even before we kind of were thinking about the Mediterranean diet, realized that was a mistake, because they're healthy foods that can replace the saturated fat, which is an unhealthy nutrient. And that's where, in our thinking, we sort of joined forces with Dimitri, Antonia, and also with friends at the Old Ways Foundation, Sarah Bersin at the late Dun Gifford, Greg Drescher, that organized Mediterranean diet conferences, which Antonia and Dimitri and Walter and a number of us here participated in, and I think really worked hard to change the whole sort of paradigm of a healthy diet. I'll just give you an anecdote. So, of course, low-fat people who advocate low-fat diet like vegetables. Vegetables are low-fat, but a lot of people say, vegetables, like vegetables. And I remembered Antonia and Dimitrios were discussing this, and they say, well, how can you possibly eat vegetables without olive oil? I mean, how, without roasting them in olive oil? Because they're terrible. And so we said, yeah, well, we agree. I think we all agree. So that was just one little thing that helped us portray the health benefits of a Mediterranean diet compared to a low-fat diet. So you can't possibly eat vegetables without roasting them in olive oil. Well, how true. So this was the publication that came out of these conferences initially. And we constructed a Mediterranean diet pyramid. I remember all the discussions that we had, like where this food should go and where that food should go. But this was in the American Journal of Clinical Nutrition, which is the top human nutrition journal. So in the 1960s, the traditional Mediterranean diet was characterized by an abundance of plant foods, particularly vegetables and fruits, breads, potatoes, beans, nuts, and seeds. Fresh fruit was the typical dessert, if there was any dessert, with sweets containing sugar or honey eaten just a few times a month, or even less than that. Total fat could range from 25%, such as in some parts of Italy, up to 43%, or in parts of Greece, like in Crete. And the olive oil was the principal source of fat. Cheese and yogurt eaten daily in low to moderate amounts. I don't know why this got messed up, but I'm sorry for that. But we published a monograph in the American Journal of Medicine following one of these conferences that really went through the whole scientific basis of the Mediterranean diet and how could that improve all of our health. And here was like the pièce de résistance, the traditional healthy Mediterranean diet pyramid, when pyramids were ruling health guidelines, especially nutrition guidelines. We always thought that was a little strange, but we wanted to, at least at that point, connect with the pyramid people who advocated a low-fat diet and say, well, we can move a few things around and make it a lot healthier and tastier. And that's indeed what we did. In particular, you can see toward the middle where olive oil, which is a fat, is in a very central position. And you can see beans, legumes, and nuts and vegetables are all in a very, very important place. So in 2003, a really blockbuster publication came out, a research publication came out as a result of Antonio and Dimitrios's their work. And so it's clear that in Mediterranean countries, adherence to traditional diets varied tremendously among people and among regions. So that variation allowed epidemiologists like them to do some studies based on that variation, and they found really that adherence to a Mediterranean diet with the score, the Mediterranean diet score, was associated with a major reduction in death from any cause, cardiovascular disease and cancer. Actually, only a 2-point increase in the Mediterranean diet score was associated with 25% reduction in death rates, and even more for coronary heart disease. And the foods that contributed to the Mediterranean diet point score were, as you see, vegetables, legumes, fruits, nuts, cereal, and fish, and eating less red meat, for example. Now, this concept that we should be eating low-fat diets really is contradicted by research from a long time ago, and one of which is the 7-country study. It's often been cited as a rationale for lowering total fat intake, but that's not what the data show at all with the 7-country study. And as you could see, there are a few different countries that have very low rates of coronary heart disease death. You can see along the bottom, you see Japan, where traditionally there is not so much fat in the diet. And then in the Balkans, Serbia, Croatia, and Crete. Now in Crete, the highest intake of total fat and actually the lowest rate of coronary heart disease death. So it's really quite impressive that a whole range of fat intake from low to high can be associated, depending on the specific diet, of a very low coronary death rate. I think this just I'm sorry to say that you guys at the media, you reformatted my slides. So just want to plead innocence. So let's see if I can remember what they said. All right, so what this is supposed to be, this is the famous Lyon heart study, and I think this is a very powerful study. It was a study in coronary heart disease patients begun when they were hospitalized for heart disease. And they were randomized to their usual diet in Lyon, France. Lyon is not a Mediterranean part of France, so they're not eating a Mediterranean diet there. Or a Mediterranean or an adapted Lyon diet, adapted really to increase intake of foods that are in the traditional Mediterranean diet. So what you see in these bars are the number of events of various diseases like heart disease, total mortality, even cancer mortality, were all substantially reduced. But of course, the number of events in there is very small, and the trial was stopped under sort of not well specified conditions prior to its scheduled end. So it looks like it's probably an exaggeration of what actually can happen. But for many years, some colleagues were trying to get a study like this done in the US, but it wasn't successful. But Grapevine tells me that finally NIH may well be seriously considering such a thing. Okay. Now, this, of course, is the famous PREDIMED study conducted in Spain. And see, we really need randomized trials of dietary patterns or diets because there are folks that simply don't believe anything but a randomized trial. And I don't agree with that at all. I'm a trialist, but I don't agree with that. That epidemiology is extraordinarily important and fills in the weaknesses in the randomized trial approach. And the randomized trial approach fills in the weaknesses of the epidemiological approach. So we need both types of studies. So in any event, it's wonderful here that we have essentially a second study of the Mediterranean diet demonstrating reduction in the cardiovascular primary endpoint and many other things. I see Miguel here, who's one of the prime movers of this study, very important study. Now, prior to that, a group in Naples by Esposito and Giuliano have consistently done studies of the Mediterranean diet in Naples. And for example, here's one published in JAMA about over 10 years ago. It's a 2-year trial in people with the metabolic syndrome, and the Mediterranean diet improved blood pressure, triglyceride levels, HDL, glucose, insulin, inflammatory markers, and actually was associated with reduced obesity after 2 years. And I'll get a little bit to this idea about diet and dietary fat and obesity in a few minutes. Also, there are some mechanistic studies where it improved the L-arginine test for nitric oxide formation, essentially showing improvement in microvascular function. Here's a study from Greece showing that the Mediterranean diet for 2 months improves endothelial function in overweight Greeks. So one teaching point here is that diet quality can greatly improve risk factors and risk of disease, even in obese people. So obese people who can't lose weight, and there are a lot of obese people who cannot lose weight, realize still could change the type of diet that they're eating. And even if they don't lose weight, they will have benefits. Also, Esposito and Giuliano did some trials on the Mediterranean diet and vascular health and how it related to improved sexual function in people who, well, overweight, older people, both men and women. And they found that in men, the International Index of Erectile Function was improved by 25% after 2 years, and in women, the analogous sexual function index was also improved by 30%, all components improved. So that's yet something. It's not that well, I haven't heard it discussed a lot, but obviously something quite important. Those of us who watch sports shows, you know, in the weekend. Seems like half of it is devoted to issues like this. So of course, if you're having, you know, if you change your diet and you're having good sex, I think maybe you might have improved sleep. And as you see here, the Mediterranean diet, actually, a study from Greece, reduced sleep apnea episodes. It's very important, improving health. And if you sleep better, you probably can think better. And this is the PREDIMED sub-study, which shows that the Mediterranean diet group improved their risk of mild cognitive impairment Particularly the mini mental state exam is considered pretty much the standard in this field, and that was significantly improved in both of the Mediterranean diet groups compared to the control. Now, how about Mediterranean diet and weight loss? Well, back in the 90s, we found it not that difficult to persuade colleagues that a Mediterranean diet, a higher fat diet, a higher unsaturated fat diet, is healthful in terms of risk factors for heart disease. But the comment always was, well, if we advocate eating, having a diet that's higher in fat, people are going to gain weight. And this obesity is a big problem, and this will never work, this Mediterranean diet. So Kathy McManus, who's director of nutrition at the Brigham, she and I planned a study of a randomized trial of the Mediterranean diet. And this is, you can see a little subterfuge by the low-fat diet advocates. Don't want us to see what this is actually saying. But what this actually is saying is, over 18 months, a randomized control study, which randomized 100 overweight and obese people to either a Mediterranean-style diet or a traditional low-fat diet, both of which were effective in weight loss. And what's more, the line for the Mediterranean diet goes like this, and same with the low-fat diet. But now, at 18 months, the Mediterranean diet kept the weight off, did not regain, whereas the low-fat diet started to regain. So certainly, proof of principle here. Participation rates were actually better long-term in the Mediterranean diet. People liked the diet better. There was a lot more they could eat. And the idea is that actually dietary variety in this case and enjoyment of food was associated with greater weight loss long-term and greater participation rates. Now, the Israeli study, Ira Shai and colleagues showed a very similar result in a very different setting, but the lower curve shows the weight loss in the Mediterranean diet, which was quite similar to a low carbohydrate Atkins diet. And in fact, at 6 years, that's what you see here, this is the long-term follow-up, the Mediterranean diet was superior to the other two diets in long-term maintenance of weight loss. Oops. Okay, there's another study that shows the Mediterranean diet produces improved insulin sensitivity. And this slide just summarizes a whole range of things, most of which I've already discussed, range of benefits. So that led to a consensus in 2000, which Dimitrios, Antonia, Walter, a group of us were involved with, and we got a large group of colleagues to agree with what you see here. And this was our consensus statement. And in the middle part was really key. Such diets need not be restricted in total fat as long as there is not an excess of calories, and emphasize predominantly vegetable oils, low in saturated fat, and partially hydrogenated oils. The traditional Mediterranean diet, whose principal source of fat is olive oil, encompasses these dietary characteristics. Thank you very much.